I just finished a colonoscopy on a 41-year-old patient, and I found colon cancer, pretty big cancer. So I thought I should do a video on colon cancer that is rising fast in young adults, and a major new study just found a surprising possible clue hiding all the way back in early childhood. I'm a gastroenterologist, and I want to walk you through this carefully because it is important. Colorectal cancer used to be a disease of older adults. I've been a gastroenterologist for more than 25 years. I've performed over 40,000 procedures over the years, but I've never seen so much colon cancer in young adults like I'm seeing right now. In adults under 50, it's been roughly doubling every decade for the past 20 years in at least 27 countries. And the strange part is many of these young patients have no family history and none of the usual risk factors. So the big question has been, why? Here is the new clue. Researchers have analyzed nearly 1,000 colorectal cancer genomes across 11 countries, and they found a specific fingerprint of a DNA damage left behind by a bacterial toxin called colibactin, made by certain strains of E. coli bacteria that can live in the colon. And that fingerprint was about 3.3 times more common in cancers of people diagnosed young, under 40, than in those diagnosed over 70 years of age. Even more striking is they were able to figure out the timing of this damage and points to exposure in the first 10 years of life. The idea is that these bacteria may quietly colonize a child's colon, damage the DNA early, and set the clock decades ahead, so someone gets colon cancer at age 40 instead of 60. Now, here is the part I really want you to hear, because this is where you need a doctor and not a headline. This is an association, not proof. The lead researchers themselves said that more work is needed to establish the cause. Colibactin's fingerprint showed up in a portion of cases, but not all of them. So this is one piece of a bigger puzzle, not the whole answer. But there is nothing you can test for at home right now. So what do you actually do with this? The same things that actually already work. And they matter more than any of us worrying about a toxin we can't even measure yet. Know your family history. Pay attention to symptoms and don't dismiss them because you're young. Blood in the stool, a persistent change in your bathroom habits, unexplained weight loss, and ongoing belly pain. These are not your too young for that symptoms. Push for evaluation and get screened on time. Screening now starts at age 45 for average risk adults. It can be even earlier if you have symptoms or family history. Screening catches this early when it's highly treatable. That is the single most powerful thing in this entire conversation. This is a genuinely exciting piece of science that may help us understand and eventually prevent early onset colon cancer. But today, the move is not fear, it's awareness and screening. Follow for more such updates in health and exciting new research.